Good morning, everybody. I'm Michel Bourrin, professor in University of Nantes, France, and editor-in-chief for the Archive of Depression and Anxiety. To make you familiar with the journal, Archive of Depression and Anxiety, is an open journal, peer-reviewed international, published by Psychoeducation Publication Private Limited. In the past few years, above and beyond serving as an online publication outlet for related science, research science, Pertech has evolved into an institutional platform to embrace and support diverse streams of medical and clinical research. With hard work and sheer determination, Pertech has developed an image of ethical and trustworthy publisher among the vast network of scholars. Archive of Depression and Anxiety is strongly supported by a group of eminent researchers. The journal publishes novel, updated research information in the branch of medicine which deal with disorders related to depression, mood, and anxiety disorders. It's providing a path for discovering new methods or mechanisms for curing chronic disease and helps other healthcare professionals to find out most recent advances in all the related areas of depression, mood, and anxiety disorder and their management. The scope of Archive of Depression and Anxiety includes topics ranging but not limiting to major depression, dysthymia, manic depression, cyclothymia, postpartum depression, seasonal affective disorder, existential depression, mood disorder due to a medical condition, medication-induced depression, substance abuse, and stress disorder, PTSD, social anxiety disorder, specific phobia, obsessive compulsive disorder, depression, treatment and management, anxiety management, anxiety treatment, postnatal depression, stroke depression, depression therapy, bipolar depression of course, and mood swings, and so on. I should be pleased if you send articles about psychoeducation in the fields of bipolar disorder. It's a very important topic, often neglected. I thank that it is a very important task of physician to well explain to patients and their families what is the illness and to prevent depression or manic and hypomanic episode. Psychoeducation for patients with bipolar disorder aims to overcome the therapeutic challenge posed by the disease by making patients actors in their care. It is part of the psychosocial therapy, essential complementary allies of the pharmacological approach in the treatment of bipolar disorder, lithium salts, neuroleptics, anticonvulsants, and antipsychotics. The objective of psychoeducation are to optimize drug treatment, improving drug adherence, preventing substance abuse, and informing about possible side effects. To help prevent relapse, facilitate the identification of warning symptoms, help to control stress situation, and help to respect the rules of hygiene. To improve the quality of life of the subject in all its dimensions, personal, family, professional, relational. To promote the acceptance of the disorder and fight stigma by informing the patient and those around him. Ignorance breeds intolerance, fears, rejection, discrimination, shame, guilt. In short, it is a matter of giving the patient the means to manage as autonomously as possible his illness and his psychosocial consequence, because the patient who does not know his illness, does not allow his life, feels unable to future to predict, feels like one of our patients would say, absolutely defenseless against the random whims his mood. Misunderstanding is an opportunistic disease that aggravates the course of psychiatric disorders. What is therapeutic education in practice regarding the treatment of bipolar disorder? Therapy with psychoeducation is based on a program that varies between 8 and 20 sessions, led by therapists, usually a psychiatrist and a psychologist. The group may consist of patients in euthymic phase out of crisis period, close relatives or mixed groups. The therapist animates and organizes the exchange, but it is the collective experience of the group and the interactivity between the participants which allow each one to appropriate the essential knowledge, like definition of the disease, medication, identification of the precursory sign of a crisis. Exchanges, interactivity, and sharing of experience form the basis of group work and essential source of psychoeducation work. It is not a matter of delivering academic knowledge, but of allowing everyone, by example, to take ownership of what the disease covers, the means, and a daily basis to manage it as best as possible in order to regain a form of control. According to the Dr. John Kabat-Zinn, apostle of mindfulness meditation, you cannot stop the flow of waves, but you can learn to surf. One of the foundations of psychoeducation is patient empowerment and the adoption of individual strategy adapted to each individual's case. The confrontation of experience allows patients to become aware of the many forms of bipolar disorder and the many ways to respond to them. They learn to discover their own bipolar disorder and the strategies that will be adapted. We have to speak about effective psychoeducation. Among the different forms of psychosocial therapy, the psychoeducation of patients with bipolar disorder is certainly the one that benefits from the most robust scientific studies. The latter showed a marked improvement in the patient's state of health. That means fewer relapse, longer intervals without crisis, better compliance with medical treatment, and fewer hospitalization. I consider my association with the Archive of Depression and Anxiety as an academic entrepreneur, because I get a chance to work with so many research scholars and colleagues who always come up with the innovative idea for the journal growth. Prominently indexing the journal is reputed platforms and getting good impact for the journal is always on priority. I consider Archive of Depression and Anxiety as one of my favorite journals because this journal is fairly specialized and closely matched to standards research outputs, and it is the best scientific sheet for our work. This journal has broad scope and expert editorial board, so the actors receive knowledge, rigorous and valid scientific peer review to improve their work. I suggest all the viewers to publish us at least once with the Archive of Depression and Anxiety. The submission to the publication process cycle is hassle-free and with shortest lead time. The visibility and relationship of the journal has a radical increase, with definitely help your article to reach its maximum hands. I will soon be back with recent updates on Archive of Depression and Anxiety. You can visit www.pertex.com for any updates. Thank you and have a great day.